You guys okay to proceed?
Yeah, it was okay.
Excellent. Okay, so we're going to start with the debrief now, which we're going to spend about 35 minutes talking about simulation. So I don't know if you'd like to start, Nina, and describe the scenario.
Yeah, we got a call out from the dispatch center that there was a man that were found unconscious on a parking lot by a bystander. And when we arrived at the scene, we found the man and he didn't respond at any point to us. So we started the assessment of the patient. Yeah, tried to be systematic, A, B, C, D, E, and then we tried to find out what the main problem was, because we had little information about what had happened. He was a known drug addict, so I think we might have that aspect with us when we assessed the patient. We tried to give him some naloxone, and he didn't give us any response on the naloxone. And then Une found an insulin pen, and then we just saw that this could be the problem.
Could be something else than when we first thought.
And Une, do you agree with Nina's description? Was that?
Yeah, I think that we didn't know what to see. I agree with your points, actually. Yeah.
Yeah. Okay. So I would like to start in terms of the debrief to try and think about, if you guys could think about what you did well in this scenario. Maybe you could start this time, Una. What went well here?
Well, in my opinion, we searched the scenario, searched the scene, and saw that it was safe to approach the patient. We didn't know anything, so I think that's important, and that's okay. And you had the lead, Nina, so I think you were good to follow the structure. At least you started with the A, and I followed. Mostly, I followed your guiding, because you were the most experienced paramedic. I think the connection between us went well. We were talking calmly and informative to each other. And I also think that we managed to do the close the loop communication between us.
Yeah.
And I also think it didn't take so long time before we found the problem.
Yeah.
So I think that's well.
Yeah, we didn't spend a lot of time during the assessment of the patient, but I think it's difficult when we both thought that this would be an overdose or something, and we kind of forgot something.
Yeah. So if we could, Nina, if we could try and focus on the positive to start off with. I think that I agree with your reflections, Una. I agree that you did check that the area was safe, and I agree with your description of the fact that you both worked very well as a team. That was very clear, and that you were systematic. And I agree that you did, one of our learning objectives was to use closed loop communication, and I definitely heard closed loop communication. What about you, Nina? Is there anything you'd like to add in terms of what you did well?
So I think we're a good team, because we are not used to working together. It was easy to work with Una, because she was follow up the things that I found during the assessment. I think that was very positive. And then it was easier to be systematic when she did her things and I did my things.
I agree. I think definitely you worked very well as a team. There was no competition between you. You were working together towards the same goal.
Yeah.
I think it was also it was in the cards that she was the leader, and that's were already set when we arrived at the scene. It was natural that you took the lead, and I could follow you because you were the most experienced one. So that made it easier.
Yeah.
For me, I don't know.
Yeah, I absolutely agree. Because this is kind of a stressful situation when you're not aware of what you can find when you arrive at the scene. And I think we could, with that we held the stress level down, and we could work.
Another thing
slower.
I thought went well was when we contacted the doctor and an appropriate time, I think, because we were not allowed to give medication glucoses according to our local protocols. So when we thought we should give it, we also consulted the doctor before.
Yeah, and when you were consulting the doctor, I was finding the medication.
So we were efficient.
Yeah,
I think.
Yeah,
that's another positive experience.
Yeah,
I think
so as well.
Yeah, I agree. I think you noticed that the blood sugar, from you saw the pen till you'd actually administered the glucose, and in that time also got IV access and called the doctor. That happened very rapidly.
Yeah,
I think, and that was that was very good.
Well, that's the light bulb came up. Oh, of course, he's not.
And how did it feel, Una, with Nina taking the lead?
It was natural. It was natural for me to follow because she is the most experienced and actually in our real jobs as well. That's her profession.
Yeah.
It's totally natural that you took the lead.
Yeah.
And it felt okay.
Yeah.
And I felt secure that you know what to do. You knew what to look for.
Yeah.
Yeah. So do you think that you covered the systematic approach?
Yes, I think so, because after we have been assessing the A, B, C, D, and E, we concluded that the patient was potential critical because we wasn't sure if the glucoses would help us.
Yeah.
And if we had spent more time at the scene, if the patient were awake, we could do also get the Vitalia, like blood pressure and
I was thinking about the blood pressure.
Maybe an ECG.
But maybe that's your profession that you thought it wasn't that important. For me, I thought, oh my God, I forgot the blood pressure. Of course, I should have done that. But
initial vitality is not that important because the patient wasn't conscious. And you use not many seconds to do the systematic approach.
No, I definitely agree that there was a lot of letters being mentioned. I always knew where we were in the alphabet. I think that was very clear that you were definitely using A, B, C, D, E. So I think
I'm not very happy about the D though. Did we say
no?
So if we just finish up with what we did really well first, okay, and kind of conclude, because we can look at learning points afterwards. So I think I agree with you both. I think both learning objectives were nicely demonstrated. And how did it go with the patient?
He started to waking up when the glucoses was given. And then we already have planned to transport the patient to the ER. After talking with the doctor, and I think we were very efficient.
We saved him actually. We did a good job.
And sometimes it could be difficult when they wake up. Maybe he wasn't wanted to go with us. And that's a bit easier when we could get him to the car.
So that's why you said let's get him in the car before.
Because I didn't want to leave him at the scene.
That was a very good point. So no, I agree. The scenario itself went very quickly. You were very systematic, and